If you rely on Social Security in any way, whether for retirement, disability, or Medicare, there are changes happening right now that you need to understand. New rules, staffing cuts, and system changes are overlapping in ways we haven't seen in decades. And if you're not prepared, you could face delays, missed paperwork, or real trouble accessing benefits you count on. Some updates may help protect the system, while others can quietly make simple tasks harder if you don't know what to expect. That's why this matters today, not later. Before we go further, let me ask you something simple. When you think about Social Security right now, do you feel mostly calm or mostly uneasy? Let me know in the comments. I'm genuinely curious where people stand on this because the responses I've been seeing are all over the map. So, here's where things start to get complicated, but I'll keep this simple. Social Security isn't just one program handling one thing. It's a massive operation that serves about 74 million Americans every single month. That includes retirees collecting the benefits they paid into for decades, people with disabilities who depend on these payments to survive, survivors who lost a spouse or parent, and folks signing up for Medicare as they turn 65. Every month, millions of payments go out, millions of questions come in, and millions of records have to stay accurate and up to date. For a long time, that machine ran quietly in the background. You didn't think about it unless you needed it. When you did need it, it was there. Sure, there were always some complaints about wait times or confusing paperwork, but overall, the system functioned. People got their checks, questions got answered, problems got resolved, even if it took some patience. Now, a lot more people are thinking about it because the machine is showing signs of strain. And I'm not talking about minor hiccups. I'm talking about fundamental disruptions to how the entire agency operates, how staff communicate with the public, and how quickly people can get the help they desperately need. Since President Donald Trump began his second term in 2025, the Social Security Administration has gone through rapid changes, unlike anything most employees there have ever experienced. The administration partnered closely with the Department of Government Efficiency, often called DOGE, led by Elon Musk. The stated goal was pretty straightforward: reduce waste, modernize systems, and crack down on fraud. On paper, those goals sound reasonable. Most people agree that government systems should be efficient and secure. Nobody wants tax dollars wasted. Nobody wants fraudsters stealing benefits meant for people who genuinely need them. The trouble is how fast and how aggressively these changes were rolled out, and what happened to the people who actually make the system work. Nearly 7,000 Social Security employees left the agency in a short period of time. That's about 12% of the entire workforce, gone in a matter of weeks. Some were laid off outright. Others took buyout packages or early retirement offers. And here's the thing that doesn't show up in the statistics. These weren't just entry-level workers answering basic questions. Many of them had decades of experience. They knew the rules inside and out, the exceptions, the workarounds, the odd cases that don't fit neatly into a computer system or policy manual. When they left, that knowledge walked out the door with them. There's no easy way to replace institutional knowledge that took 20 or 30 years to build. You can't just hand someone a training manual and expect them to handle complex disability cases or survivor benefit calculations the next day. That expertise is earned through years of seeing thousands of unique situations and learning what works and what doesn't. At the same time, demand didn't slow down. In fact, it increased. Baby boomers are retiring in large numbers, about 10,000 people turning 65 every single day. Disability claims are complex and often involve extensive medical documentation. Medicare enrollment isn't getting any simpler, especially with all the different plan options and deadlines people have to navigate. So, you ended up with fewer workers handling more cases during a time when the workload was already growing naturally, and that's where the backlog started piling up fast. Internal documents that leaked to the press showed staggering numbers, as many as 6 million pending cases sitting in processing centers and around 12 million unfinished transactions in field offices across the country. Those numbers aren't abstract statistics on a spreadsheet. They represent real people waiting for answers, for payments, for approvals they need to move forward with their lives. Now, maybe you've heard about the long phone wait times. Maybe you've even experienced them yourself. At one point earlier this year, the average wait was about 2.5 hours. That's not a typo or an exaggeration. People would call first thing in the morning, put the phone down on speaker, make breakfast, make lunch, do laundry, come back, and still be waiting to talk to someone. Some folks reported waiting 3, 4, even 5 hours before getting through or giving up entirely. Management responded by pulling workers from other departments and putting them on the phones to bring those wait times down. On the surface, that sounds like a practical solution. If the phones are ringing off the hook, get more people answering them. The problem was many of those workers didn't get much training before being thrown into phone duty. Some employees described it as being told to just figure it out, or getting maybe a day or two of shadowing before handling calls on their own. That helped bring the average wait time down on paper, and the agency could report improved metrics to Congress and the public. But it created new problems elsewhere that were just as serious, maybe even worse. You see, when someone spends all day answering phones, they aren't processing claims, updating records, reviewing documents, or doing the detailed work that actually moves cases forward. So the calls got answered a bit faster, but the actual work backed up even more. The pile just shifted from one desk to another. One union leader summed it up simply and powerfully. That work piles up, and once it piles up, it doesn't magically disappear. Somebody has to do it eventually, and every day we fall further behind. The frustration in that statement reflects what so many employees are feeling right now. They want to help people, but they're being asked to do impossible things with insufficient resources and constantly changing directions. Another major change involved fraud prevention, and this is where things got really contentious. Again, the goal sounds completely reasonable. Nobody wants benefits stolen by scammers or identity thieves. Protecting taxpayer money and legitimate beneficiaries from fraud is absolutely important. But the way these new security measures were implemented caught a lot of people off guard and created unexpected hardships. Certain actions, like changing direct deposit information or updating addresses, can no longer be done over the phone in many cases. You have to do it online through the My Social Security portal, which requires creating an account with identity verification. Or you have to go in person to a field office with specific forms of identification and sometimes additional documentation. The security checks are stricter, the authentication requirements are more complex, and the margin for error is smaller. That's perfectly fine if you're comfortable with computers, have reliable internet access, own a smartphone that can receive verification codes, and can easily travel to an office if needed. But for many seniors and people with disabilities, that's a tall order. Not everyone has internet at home. Not everyone has a smartphone. Not everyone can drive or take public transportation easily, especially if they're dealing with mobility issues or live in rural areas where offices are far apart. There was one case that really stuck with me when I heard about it. A 75-year-old man had suffered a massive stroke and couldn't drive anymore. He changed banks because his local branch closed, and he needed to update his direct deposit information so his Social Security check would go to the right account. He couldn't navigate the online system, he didn't have family nearby to help him, and he couldn't physically get to the field office that was over an hour away. The employee on the phone genuinely wanted to help him. You could hear it in her voice. But under the new rules, her hands were tied. She ended up telling him to ask a relative for help or call his bank to see if they could set up a redirect, neither of which actually solved his problem. She hung up feeling terrible. He hung up feeling abandoned. You can hear the frustration in stories like that on both sides of the line. Employees who want to serve the public but can't. Beneficiaries who followed the rules their whole lives and now feel punished by bureaucracy. And this isn't a rare outlier. These situations are happening thousands of times a day across the country. Field offices have been crowded, sometimes with lines out the door. Appointments are hard to get, often booked weeks or even months in advance. People are told to come back later or try calling again. Some folks show up in person because the website didn't work for them or because they didn't understand the online system, only to find out they still can't resolve their issue that day because they don't have the right documents or because the staff member they need to see isn't available. Imagine being close to a deadline, maybe for renewing a driver's license that requires proof of your social security number, or for enrolling in Medicare before you face a penalty, and being told to wait again. The stress compounds, the anxiety builds, and people start to feel like the system doesn't care about them anymore. Leadership instability hasn't helped matters at all. In a 6-month span, the agency went through 3 acting commissioners. Policies were rolled out, then reversed, then adjusted again. Regional offices were eliminated in a rush without clear transition plans. Employees were reassigned repeatedly, sometimes without understanding why or what their new roles would be. One former acting commissioner even admitted publicly that he flipped the switch, knowing there would be casualties, and described the agency as being subject to political whims. That kind of uncertainty makes it hard for any organization to function smoothly, let alone one serving 74 million people. When employees don't know what the rules are from one week to the next, when they're afraid to make decisions because policy might change again tomorrow, everything slows down. People become cautious. They second-guess themselves. They wait for clarification that sometimes never comes. And meanwhile, the public suffers the consequences. Eventually, a permanent commissioner, Frank Bisignano, was confirmed by the Senate. He came in with a private sector background and immediately authorized overtime and emergency measures to deal with the backlog. The agency says it has reduced processing delays by about 1 million cases and cut disability backlogs significantly. That's real progress, and it's absolutely worth acknowledging. People are getting decisions who were stuck in limbo. Checks are going out that were delayed. That matters enormously to those individuals and families. At the same time, independent audits and watchdog reports showed that some of the improved phone statistics were misleading. Calls counted as having 0 wait time often involved callbacks that took an hour or more to actually receive. So, the experience didn't always match the numbers being reported to the public and to Congress. When people feel like they're being told things are getting better, but their personal experience says otherwise, it breeds cynicism and distrust. Public reaction has been intense, and honestly, that makes complete sense. Social Security isn't just a policy debate happening in Washington. It's not an abstract political issue. It's rent money, it's groceries, it's whether someone can afford their medication this month. It's the difference between staying in your home or losing it. For millions of Americans, this is survival. People talk about spending entire mornings on hold, about finally getting through and being told they need to call a different number or submit more paperwork. They talk about kind but overwhelmed employees apologizing for delays they can't control, sometimes even crying on the phone out of frustration. Some people are angry, feeling betrayed by a system they paid into their whole working lives. Others are scared, worried about what happens if their payment stops or their appeal gets denied. And many are just tired, exhausted from fighting for something that should be straightforward. There's also a significant political divide in how people interpret what's happening. Critics argue that the agency has been weakened on purpose, that cutting staff and pushing everything online makes the system less accessible, especially for the most vulnerable populations. They worry this is a deliberate step toward shrinking the program further down the road, part of a broader ideological agenda to privatize or reduce social safety net programs. Supporters of the administration counter that modernization is long overdue, that fraud has reached unacceptable levels and has to be addressed aggressively, and that short-term pain is unavoidable if the system is going to survive long-term. They see this as a necessary reset, arguing that tough choices now will prevent a worse crisis later. They point to the fraud cases that have been caught, the inefficiencies that have been eliminated, and the technology upgrades that are being implemented. Both perspectives contain elements of truth, which makes this situation so complex and so difficult to navigate for everyone involved. Geography plays a huge role in how these changes affect people, too. If you live in a rural area and your nearest field office is 2 or 3 hours away, in-person requirements aren't just inconvenient, they're a genuine barrier. Some people rely on neighbors for rides or community transportation services that only run certain days. Others simply give up because they can't make it work with their health conditions or work schedules. That's a very different experience than someone who lives 10 minutes from a field office in a city, has reliable high-speed internet, uses a smartphone daily, and feels comfortable navigating online systems. For that person, the changes might be minor annoyances at worst, maybe even improvements if they prefer handling things digitally. This digital divide has always existed, but these policy changes have made it more consequential than ever before. If you can't or won't go online, your options have narrowed dramatically, and that affects older Americans disproportionately, as well as people in poverty, people with certain disabilities, and rural communities. What worries many people the most, and what I hear about constantly, is trust. Social Security is built on a long-term promise. You pay in for decades through payroll taxes, expecting that the rules will be clear and the system will be there when you need it. It's a social contract, a mutual agreement between generations and between citizens and their government. When policies change quickly without much public input, when guidance shifts from month to month, when you can't get straight answers to simple questions, that trust erodes. And once trust is gone, it's incredibly hard to rebuild. People start to question everything. They wonder if their benefits are secure. They worry about future cuts. They fear they'll be left behind if they can't keep up with new technology or new rules. That psychological dimension is just as important as the practical problems. Even if your check arrives on time, if you're constantly anxious about whether next month's will come, that affects your quality of life, your mental health, your sense of security. And for people who are already dealing with serious health issues or financial struggles, that added stress can be devastating. Now, I don't want this to sound like everything is falling apart tomorrow or that you should panic. Checks are still going out every month. Benefits haven't stopped. The vast majority of transactions still get processed, even if they're slower than before. The Social Security system isn't collapsing, but the friction has increased significantly, and that friction shows up at the worst possible times when people are already dealing with health crises, retirement transitions, divorce, death of a spouse, or financial stress. So, what does this mean for you right now in practical terms? First, it means staying informed matters more than ever. If you're approaching retirement in the next few years or helping a family member navigate Social Security, don't wait until the last minute to start the process. Give yourself extra time, lots of extra time. What used to take a few weeks might now take months. Start gathering your documents early. Make sure your earnings record is accurate by checking it on the Social Security website. Understand what you'll need to prove your identity and eligibility. Second, document absolutely everything. Keep records of every phone call, including the date, time, who you spoke with, and what they told you. Save confirmation numbers, take screenshots of online submissions, make copies of every piece of paperwork you submit, and I mean everything. If something gets lost in the shuffle, which happens more often now, you'll have proof of what you sent and when. This isn't paranoia, it's protection. Third, if something feels off or wrong, don't assume it will fix itself quickly. Follow up persistently, check on the status of your claim or application regularly. If you were told you'd hear back in 30 days and you haven't after 45, call again. Be polite but firm. Keep notes of these follow-ups too. Persistence matters in a backlogged system. Fourth, explore all your options for getting help. Some nonprofit organizations specialize in Social Security advocacy and can help you navigate the system for free or low cost. Your local area agency on aging might have counselors who can assist. Your congressional representative's office has staff dedicated to helping constituents with federal agencies. Don't hesitate to reach out for help if you're stuck. You don't have to do this alone. Fifth, if you're able to use the online systems, learn how to do it now before you urgently need to. Create your My Social Security account, familiarize yourself with how it works, and make sure you can log in. If you're not comfortable with technology, ask a trusted family member or friend to help you, or see if your local library offers computer classes for seniors. Building these skills now will save you enormous frustration later. What I'll show you next might surprise you because it surprised me when I really dug into this. Despite all the turmoil, all the chaos, all the frustrating headlines, most of the people inside Social Security still care deeply about helping the public. I've read dozens of interviews with current and former employees, and the overwhelming theme is dedication mixed with heartbreak. These are people who chose careers in public service because they wanted to make a difference. They take pride in helping someone get their first retirement check, in approving a disability claim for someone who desperately needs it, in making sure a widow receives survivor benefits after losing her husband. They celebrate when they can solve a complicated problem. They remember the thank you notes they receive from grateful beneficiaries. Many of the delays and problems aren't because of indifference or laziness. They're because the system these dedicated employees are working in is stretched far too thin. They're being asked to do more with less, to meet impossible standards, to navigate constantly changing policies, all while facing public anger that's really directed at decisions made far above their pay grade. Remembering that doesn't fix the problem. It doesn't make your wait time shorter or your case move faster. But it can help explain why things feel the way they do, and it can help us direct our frustration at the right targets, the policy decisions and resource allocations, not the individual workers trying their best in a broken system. Many of these employees are working voluntary overtime, coming in on weekends, skipping breaks, just to try to make a dent in the backlog. Some have set up informal support networks to help each other cope with the stress. Others have become advocates for change within the agency, speaking up about what's not working and what needs to be fixed. Their voices matter, and they deserve to be heard and supported. So, stepping back for a moment, the big picture is genuinely complicated. The administration's stated goals, efficiency, modernization, fraud prevention, are real goals that most people would support in principle. The question has always been about execution and balance. Can you modernize without leaving people behind? Can you prevent fraud without creating impossible barriers for legitimate beneficiaries? Can you reduce costs without sacrificing service quality? The execution over the past year has created real pain for real people. That much is undeniable. Whether this ultimately leads to a stronger, more accessible system, or one that feels distant and harder to navigate depends entirely on what happens next. It depends on whether lessons are being learned from the mistakes. It depends on whether resources are restored where they're needed most. It depends on whether the voices of struggling beneficiaries and frontline employees are heard and taken seriously. There are some positive signs. The permanent commissioner has acknowledged the problems openly and pledged to address them. Overtime has been authorized. Some of the most extreme policies have been walked back or modified. Congress is paying attention, holding hearings, and asking tough questions. Advocacy groups are mobilizing and speaking out. The media is covering these issues more consistently. Public pressure can drive change when it's sustained and focused, but there are also ongoing concerns. The long-term funding challenges facing Social Security haven't been addressed. The trust funds are still projected to face shortfalls in the next decade if Congress doesn't act. Technological modernization is expensive and takes years to implement properly. Rebuilding staff expertise after losing so many experienced workers will take time, training, and commitment. And political divisions make it hard to achieve the kind of bipartisan cooperation that major reforms would require. If you haven't shared your thoughts yet in the comments, I really encourage you to do so. Are you calm or uneasy about Social Security right now? Have you personally experienced these delays or problems? Are you worried about the future, or do you think the changes will ultimately be positive? Hearing how others are feeling really helps put this into perspective and builds a community of shared experience and mutual support. Your voice matters beyond just this comment section, too. Contact your congressional representatives and senators. Tell them your story, explain how these changes are affecting you or your family. Congressional offices track constituent concerns, and when they hear the same issues repeatedly, it influences their priorities and their votes. Support advocacy organizations that are fighting for Social Security beneficiaries. Groups like Social Security Works, the National Committee to Preserve Social Security and Medicare, and AARP have the expertise and the platform to push for policy changes. They testify before Congress, meet with agency officials, and mobilize public campaigns. Your membership and your donations amplify their impact. Stay informed through reliable sources, follow news coverage, read official Social Security announcements, and be skeptical of rumors or misinformation on social media. Understanding what's actually happening as opposed to what people fear might happen allows you to plan better and advocate more effectively. This moment in Social Security's history matters enormously, and not just for the 74 million people currently receiving benefits. It matters for everyone who expects to rely on Social Security in the future, which is most Americans. The decisions being made right now about staffing, technology, service delivery, and access will shape the agency for years or even decades to come. Paying attention now, staying engaged, and speaking up can make a genuine difference. Government agencies respond to public pressure. Policies can be changed. Resources can be restored, but only if enough people care enough to demand it. Social Security represents something profound in American society. The idea that we take care of each other, that we honor the contributions people make throughout their working lives, that we don't abandon the elderly, the disabled, or children who've lost parents. It's not perfect, and it's never been perfect, but it reflects our values as a society. What we do to strengthen or weaken it says something important about who we are and what we believe. So stay informed. Document everything. Be persistent. Help others navigate the system if you can. Share your experiences. Demand accountability. Support the workers trying to make things better. And don't lose hope that change is possible, because it is. These problems are serious, but they're not unsolvable. With enough attention, enough pressure, and enough collective action, we can ensure that Social Security remains the reliable foundation millions of Americans depend on. Thank you for watching, and I'll see you in the next one.